her whole body would shake. She would like convulse, and then she'd start to cry.
They're just two normal parents trying to figure out why their daughter was screaming.
I went from being this beautiful child to being Quasimodo.
I thought I was going to live forever. That was my plan.
Next, 3 medical mysteries that defied the experts. For years, Laurel and Dave Garland watched as their daughter Emily suffered through excruciating pain that baffled everyone.
And the pain was so severe that she wasn't just crying, she was screaming.
Ashley Tabling spent 2 decades trying to understand the freakish changes that were destroying her body and her life.
I had reached my breaking point.
And Len Geiger, an avid athlete who had no idea why he was slowly starting to suffocate.
I don't think I've ever been so terrified in my life.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. For the first few years of her life, Emily Garland was the picture of health and happiness.
She was always outgoing, was active, high energy, very high energy. Just a happy, outgoing child.
But when Emily reached the age of 2, her mother Laurel noticed something alarming.
We were having lunch, and she just kind of started to cry and just put her hand up to her cheek a little bit. And she was talking at that time, but couldn't really tell me what was wrong, and I assumed that she had bit her tongue or something while she was eating. So I just comforted her, and she stopped crying and then went on to finish her lunch. So I didn't think anything of it. And then for the next couple days, it happened again when she was eating. And I thought, well, maybe she, bit the inside of her cheek and she's just kind of rebiting it, or that maybe the food is burning her cheek or something.
But over the next several weeks, Emily continued to experience painful episodes.
It was happening at different times, not just while she was eating, but maybe while she was drinking something through a straw, or in the bathtub if she was getting water splashed on her face, she would start to cry.
We would console and help her through the period, which would often only last a few seconds.
The first time that I became aware of anything bothering Emily was when her mother and I were talking on the telephone. Emily was in the bathtub, and I heard Emily screaming in the background, and Laurel said, "Just a moment, Mom." Laurel came back to the phone and said, "Well, gee, that was strange, but she must have bitten her cheek."
I remember being in the room on one of my visits and her crying out and putting her hand to her face. And Lori said, "Oh, honey, did you bite your cheek again?" And Emily would nod, yes. I think she just didn't understand what her mommy was asking her. All she knew is that she had pain, and her mother was acknowledging that she had pain. And Lori said, she keeps biting her cheek. I don't know what to think about it. It's very strange. She keeps doing it.
I would look inside to see if there was a sore on her tongue, or if there was something on her cheek that you could see, and there was never anything there.
Thinking it might be a toothache, Laurel took Emily to the dentist. But after a full exam, the dentist found nothing out of the ordinary.
I'd asked him, well, should we do x-rays to make sure? And he said no. He said he didn't need to because he could see that her teeth were fine. He said that if she had a cavity that was bad enough to be causing pain, that he would be able to see it, and he couldn't. So we kind of went away with no answer.
I think Laurel may have thought that there's something more going on than myself. I just tended to think, well, she's biting her tongue, or it's going to pass. I think that's a lot of fathers' attitudes with a lot of things is, it's going to pass, we don't need to do anything.
But as the months passed, Emily's mysterious episodes began erupting with increasing intensity. Laurel was getting scared.
She would have episodes when we were changing her clothes, like pulling her shirt up over her head, or if the wind would blow her hair against her face, or if she was just running sometimes and just her body jostling as she ran, she would just stop short and start to cry.
We never saw any warnings. It would just happen. The pain would just start instantly, and it was intense instantly.
Her whole body would shake. She would like convulse, and then she'd start to cry, and she'd put her hand up to her mouth.
She'd go like this, and her hand would bounce. I remember because she wanted to put her hand on her face, but she didn't dare put her hand on her face. And she'd be like, you know, and then it'd be gone, and then she'd stop. And she'd talk like this. It was very sad.
When the pain subsided, she would resume whatever was going on before it started.
We were just stumped. I mean, we would talk to each other and say, well, what if it's this, or what if it's that? It was just confusion. We didn't know what to think.
Frustrated and lost, Laurel decided to take Emily to a new pediatrician.
And of course, Emily was fine during the doctor's visit. She had no symptoms. She was happy-go-lucky. Everything was great. And so the only thing the pediatrician had to go on was what I was telling her. And the only thing she could think of was that maybe Emily had stones in her salivary gland, which I had never heard of, but she said that you can get stones there just like you do in your gallbladder, and that it's very painful.
The pediatrician referred them to an ear, nose, and throat specialist.
He did a visual exam of her face and looked inside her mouth and felt around her cheek and said that she didn't have stones and that he didn't really have any idea what it could be. I knew there was a problem, and it just didn't feel like I was getting a response.
Then, to Laurel and Dave's surprise, the pain went away for a few weeks. But by the time Emily turned 4, it was back again with a vengeance.
The pain episodes became much longer in length. Initially, they were a couple seconds typically, and they were now approaching maybe 10 to 15 seconds.
It was like she was being struck with electricity. You'd see her body and her face starting to shake, and her eyes would get real big, and you knew that it was coming. But she didn't want you to touch her. She would push you away.
Soon, Emily began to develop tactics for coping with her pain.
She would stop playing and sit down and just sit on the couch, kind of still and quiet, which is not like her at all. So we would know when she was having a bad day because she would be kind of not herself, almost kind of zombie-ish.
She couldn't even open her lips wide enough to get a tiny little baby spoon in with some applesauce. She just couldn't do it. She went like this, you know, and it wasn't worth it to her to eat out. She's starving. You could see it in her eyes. She was starving. She was so hungry, but it wasn't worth it to her.
We wanted so badly to get rid of the pain, and again, being helpless. Nothing we could do seemed to work.
They were exhausted. They were tired. They're just two normal parents trying to figure out why their daughter was screaming. They didn't know. None of us knew.
I was sort of in a state of panic by then. The pain was so severe by now that she wasn't just crying, she was screaming. So much that she lost her voice. So she was screaming and nothing was coming out. It was just horrific.
Since the age of 2, Laurel and Dave Garland's daughter Emily has been experiencing mysterious episodes of pain in her cheek. Now at age 4, Emily's condition is getting worse, and the Garlands are at their wits' end. Hoping for an answer, they take Emily back to the pediatrician, but instead of a diagnosis, they get a surprise.
She said that she thought that maybe Emily was faking it to get attention.
It was discouraging at first, but it sounded like as real of a possibility as any other possibility we'd been given.
And Emily always likes to be the center of attention, so it wasn't that far-fetched to us.
So Laurel and Dave tried to break Emily of what they thought might just be a ploy for attention.
So what we did for several weeks was we would ignore it when she would start to cry. If she would tell us, my cheek's hurting, we would say, no, the doctor said there's nothing wrong with your cheek.
But then something happened that told the Garlands that it was real.
She started waking up in the middle of the night, crying.
Little girl looking for attention is not going to scream out in the middle of the night. It didn't make sense. It didn't make any sense at all.
Laurel and I decided this is not a kid who's looking for mom and dad to come rub their back.
When we realized that she wasn't faking it and that we had treated her that way for so long, it was just a horrible feeling of guilt.
Lori said, I can't believe that I punished her for having that cheek pain. She goes, I don't think I'll ever forgive myself for that.
Desperate, Laurel was ready to try anything.
I was kind of at the end of my rope. I didn't know who to take her to, so I just opened up the yellow pages and looked for a pediatric dentist, and that's where I took her, and that was Dr. Highshaw.
When I came in and saw Emily, Laurel was standing by her, coaxing her just to, sit in the chair, but she was very delightful. She wasn't running around all over the place. Laurel was just wanting to find out what was the cause. She was still very calm, but you could sense the anxiousness in her.
She was great with Emily. She has such a sunny personality, and she's great with kids. She was sort of the first doctor who really sort of committed to helping us find out what was going on.
Starting at the beginning, Laurel walked Dr. Highshaw through all the strange symptoms Emily had experienced over the past 2 years.
What was going through my head was, this is something that is not dental related. But the description of the sharp pain on one side of the cheek, my thoughts were going to that this must be neurological in origin. My theory was that this could be trigeminal neuralgia. The only thing was she was a 4-year-old child, and this is just very uncommon.
And I'd never heard of that before, and I said, "What did you say?"
Trigeminal neuralgia, or TN, is a disorder that doctors believe is triggered by the compression of the trigeminal nerve located in the brain. When the nerve is compressed, it sends bolts of intense electric shock-like pain into the face, where the branches of the nerve extend.
Immediately, Dr. Highshaw said, she mentioned the words research, she mentioned let me get back to you. She didn't have an answer right there, but she was the first person that said we need to figure out what's going on here. And that, at that point, was awesome, it was incredible. I remember feeling very relieved just to hear something mentioned as far as a specific condition.
They had this huge sense of relief that they had finally found somebody who cared, somebody who actually could possibly have a diagnosis.
It didn't fit the parameters of a patient who should have trigeminal neuralgia, but it was my best guess, and I just wanted someone who was specialized in that field to do the further test.
Dr. Highshaw recommended they take Emily to Dr. Abhay Sanan, a neurosurgeon who specializes in TN.
Trigeminal neuralgia is a very painful disorder. It is so painful that there have been reports of patients being driven to suicide because of the pain that it generated.
Dr. Sanan immediately ran a series of tests to determine if Emily had this rare disorder. The results were shocking.
Emily is the first child that I've seen carrying the diagnosis of trigeminal neuralgia, and it is possible that I may go my entire career without seeing another case in a child as young as hers.
I was very relieved because we had found something. There was something there, and so we were treating it. It felt like finally we're doing something to help her.
To relieve Emily's pain, Dr. Sanan prescribed an anti-seizure medication, usually used by adults. For this little girl, the treatment is not without danger.
The anti-seizure medicine does carry risk. The rarer side effects could include liver damage, and that's why we have to check liver function tests in patients that are on this medicine.
But for the Garlands, it was well worth the risk.
I gave Emily her first dose in the car as we were driving away from the pharmacy.
Almost instantly, Emily was back. Her personality was back, and the pain was gone almost instantly.
I felt so happy and relieved, and it was just finally over.
TN is treatable but not curable. Emily will be living with it for the rest of her life.
Trigeminal neuralgia is a benign condition in the sense that this is not cancer, this is not something that necessarily threatens life or limb. So her prognosis from that perspective is excellent. However, her prognosis that she'll live an entirely pain-free life is uncertain, and that only time will tell.
We're actually lucky that she got diagnosed so soon because many people suffer for years and years. I've met people who suffered with it for 10 years and never got a diagnosis.
With the proper diagnosis, Emily was finally given her childhood back.
And I just remember one day just sitting there and I just kissed this cheek over and over and over and over because it was like I couldn't kiss that side of her face for 2 years, and it was like I need to get caught up over here. So I just remember kissing her over and over. And she was like, "Oh, Mom."
Emily Garland's rare and painful disorder struck when she was just a toddler. But Ashley Tabling's problems didn't start until adolescence.
When I was a young child, I was a very cute kid. I don't mind telling you that. I was a very cute kid, and I went from being this beautiful child to being what I would consider almost like Quasimodo.
It all began when Ashley was 10 and her weight skyrocketed.
It was an absolute struggle for me to deal with the issues of gaining weight and looking different than everyone else, because at the age of 10, What does every girl want to do? Be like everyone else.
She was the overweight girl in school whom was made fun of, which, was very sad.
Most girls go through a chubby stage, so that's exactly what we thought it was, her chubby stage. She's just a little girl growing up, and there's nothing unusual. That's what I thought.
And then something completely bizarre happened.
I would wake up and my hair almost looked like a rat's nest. My hair went from being poker straight to being like a Brillo pad. And the more you would brush it, the more it would start looking like a Brillo pad. So there was absolutely nothing you could do. It wasn't curly, it wasn't straight, it was just frizz.
It always seemed to have really a mind of its own, not manageable.
We thought really nothing of it, just adolescence and her body changing.
But soon, Ashley began to experience other abnormalities.
A few months after my hair changed, I also started noticing skin tags around my neck. Again, it wasn't anything that we thought was unusual. It was just another one of those things coming of age. And my parents took me to a dermatologist. We got them removed, and that was the end of the story. Didn't have to deal with them anymore, so we thought.
Then, at age 12, Ashley was mortified to discover an even stranger development.
I'm now growing some hair on my chest. And I thought, maybe it's just one of those things. Sometimes you get a stray hair here or there.
She started saying, Mom, look at this freak hair. And I get the plucker and I just pull it out. I say, now forget about it. I said, it's just a hair. But that wasn't the case.
Puberty is tough for every girl, but for Ashley it became almost unbearable.
When I was 13 years old is when I first got my period. It was very painful. I would go a couple months without having a menstrual cycle. Then I would get the menstrual cycle. I would have severe cramping, severe bleeding. I never anticipated sitting there having to raise my hand in front of a teacher to say, I think I have to go to the nurse, there's a problem. Get up from my chair, and there just being a puddle of blood everywhere, everywhere.
Concerned with the severity of Ashley's menstrual symptoms, her mother scheduled an appointment with a gynecologist.
So at 13 years old, I was put on birth control pills with no further explanation as to why things were happening to me. Just, it's a hormonal thing, don't worry about it, stay on the birth control pills and you'll be fine. Something was strange. Something was definitely not right, and I even had the sense when I was much younger to know that something was not right.
Since the age of 10, Ashley Tabling has been suffering from strange symptoms that were wreaking havoc with her body and her self-esteem. Now a gynecologist has put her on birth control pills to manage her excruciating menstrual cycle. At first it seemed to work, and her other symptoms began to disappear.
We got rid of the skin tags, the hair started looking better, then everybody thought, hey, look, the doctors were right on the money, and it was a hormonal thing, and she's getting older. So, you know what? She's got a little bit of a weight problem, and we'll just have to deal with that. That's just one more hurdle to get over, and after we get over that, everything is going to be fine.
But it was far from fine. At 16, Ashley ballooned to almost 200 pounds.
She would get teased, and her feelings would get hurt. And, that hurt me.
My father would say to me, sometimes people have a hard time dealing with losing weight on their own, so I cut this out for you, an article about a weight loss camp, and maybe what you need is just a little help, a little bit of direction. So I took the opportunity that was handed to me, and I went to weight loss camp.
So to certain people, we're like, oh, she's away at drama camp. It's embarrassing. You don't want to tell people, yeah, I'm at the fat farm.
Embarrassing though it was, Ashley gave it a shot.
We would wake up every morning and they would have the meals made for us, and then we would go through aerobic workouts. We would play all the same games that everyone played at camp, and you really didn't even notice that you were there to lose weight.
And it seemed to work.
Visiting day, I drove up with her parents and her sister and brother-in-law. She had muscle tone. She had lost weight, and with those things combined, she looked the best I had ever seen her.
I lost close to 60 pounds when I was at camp. I remember my parents coming up on Visitor's Day to visit me. They didn't even recognize me. I had to go, Mom, it's me.
We picked her up. She was so gorgeous. and so thin. After going there, being so heavy and so unhappy with herself and so depressed, and I see this bubbly, thin, beautiful girl. See, I'm crying. Every time I think of that story, I cry.
For a while, it looked like the healthy eating and exercise habits that Ashley learned at camp had done the trick. But Ashley soon realized the fight had only just begun.
When I came back from weight loss camp, it was a constant battle to keep the weight off.
Through her college years and into her 20s, Ashley's battle with her weight continued.
I would have points where I got extremely heavy, and then I would lose all the weight again. That, I think, was one of the strangest things of all, is that, you know, I would gain weight quickly, but then in the same turn, it would come off like water.
It was like, you know, up and down. It was like a Richter scale. It was crazy. We never knew for every 6 months what closet we were going to be taking clothes out of.
I may not have known that there was something seriously wrong with me, but I knew something wasn't right.
Ashley did her best to live a normal life. In 1996, she married John Tabling. 3 years later, they decided to take the next step.
My husband took me out to dinner New Year's Eve, 1999. He said, I think it's time to have kids. I said, what did you just say? You're kidding me, right? After being on birth control pills for 17 years, I threw them away.
It was a decision that would prove devastating for Ashley.
After I stopped taking the birth control pills, I noticed I still didn't have a menstrual cycle. We've been actively trying to have kids, but nothing's happening. I took pregnancy tests, I'm not pregnant. Another month goes by, another 2 months goes by. Not only do I not have a menstrual cycle, but I had put on significant, and when I say significant, I'm not talking 20 pounds. I'm talking close to 100 pounds in weight within a 3-month period.
It was as if somebody had pumped her up with steroids. Incredible.
I started to notice hair on my chin. Having to deal with having a beard, that's really scary, really scary. After the hair appeared, I was then dealing with acne. I was having these breakouts that I could not control. And then after the acne, I started noticing I had skin tags again. And then I started getting dark patches on my arms, under my knees, even under my lip. It looked like I had bruises, and no matter how much I would sit there and scrub and scrub and scrub, it wouldn't come off.
It's just like everything hit at once with a vengeance. And at that point, Ashley and I both realized that, you know, this is it. Something has got to be done, and we have to find out what's wrong with you.
Desperate for answers, Ashley made an appointment with her physician.
You know, I said, I don't get it. I said I went off the birth control pill, and then all of a sudden, all of this stuff started happening to me. You know something? There's nothing wrong with you. It's your hormones. You had a problem before you went on the birth control pill. You just went off the birth control pill. It's everything evening itself out again. I had reached my breaking point. I was pissed.
Then in January 2000, just when Ashley had reached her wit's end, she found Dr. Mark Harwood.
When I walked in, I was a little taken back because he was very young, and I'm like, oh my goodness, fresh meat right out of school. Am I talking to the right person? Maybe I wanted somebody just a little bit older.
What I remember was the frustration that she experienced, and it sounded as if she had been through the mill, so to speak.
I said, you are gonna think that I am a total nut, but I'm just gonna tell you like it is, and then you can tell me to either go my merry way or that there's something wrong with me.
My usual lead-in question is just, tell me your story. And then she told me kind of what she had been through. I went to the back and looked at a textbook, and basically, you know, there could have been a picture of Ashley next to Polycystic Ovary Syndrome. I basically photocopied it for her, brought it in, and said, this is what I think is going on. I'm not 100% sure, but we'll run some tests and we'll learn about this together.
In Polycystic Ovarian Syndrome, or PCOS, excess insulin causes the ovaries to produce large amounts of the male hormone testosterone, which stimulates the growth of cysts in the ovaries and leads to weight gain, excessive body hair, and irregular periods. The exact cause is unknown, but doctors think it may be hereditary.
When I found out what was going on with me, it was bittersweet. I had a name to it. I knew that there was some sort of solution. You're faced with the fact that yes, you have a syndrome, and yes, there are some physical abnormalities as a result of the syndrome. Having to deal with them does a number on your head.
Though her physical ailments had caused her so much grief, the symptom she couldn't see was the most unbearable.
He said that a lot of women that have polycystic ovary syndrome have problems with infertility. And I think my heart dropped into my stomach when he said that. Because for as long as I can remember, the one thing that I wanted more than anything else in my life was to be a mother.
I really didn't know whether or not she was going to be able to have children.
My head was spinning. I didn't know what to do. I didn't know what to say. It was just a really crazy, difficult time.
For nearly 20 years, Ashley Tabling suffered from a strange, disfiguring condition that no one could diagnose. Finally, at age 30, she has discovered that she has Polycystic Ovary Syndrome, or PCOS. While the condition itself is not fatal, Ashley is devastated to learn it can cause infertility. Desperate for the chance to have her own children, Ashley tracks down Dr. Catherine Sharif, a specialist in PCOS.
Ashley was anxious. She wanted to be healthy. She wanted to be at a healthy weight. And she wanted to have children.
Dr. Sharif treated Ashley with an insulin sensitizer to help control her insulin levels and balance her hormones.
After 6 months of being on the insulin sensitizer, I started losing weight. I had a normal menstrual cycle. The acne completely went away. The skin patches started to become lighter and lighter and lighter. The skin tags, certainly I had to deal with the ones that I had, but I wasn't growing any more skin tags. The hair, I wasn't growing more hair, but I still had to deal with the hair that I had. I couldn't believe I was taking off weight left and right. I was amazed.
And what happened next was nothing less than a miracle.
April 4th of 2001, I had a daughter. I had a daughter, which, oh my God, just most incredible feeling in the world. I never thought that I was going to get there, and I had a baby. I had a baby. After everybody told me that I couldn't have a baby, I had a baby.
I thought it was, like the greatest thing I had ever heard in my life.
I cried. I didn't say anything. I just cried. I got hysterical and I cried. And when the day she was born and I saw her, I got hysterical and I cried.
And just 1 year later, yet another miracle.
I remember I called my husband and I said, I hope you're sitting. And he's like, yeah, I'm sitting. What's going on? And I said, I'm pregnant again. And I literally heard the phone drop and heard him hit the floor.
I think that Jacob is the second miracle. The rest of Ashley's life is going to be one little miracle after another. Her future looks really good now.
The symptoms that I have definitely improved significantly, but they are always going to be with me, and there is always going to be a battle.
Though things are looking up for Ashley, it's still a day-to-day struggle, especially with her weight.
From now until the day I die, I will always have PCOS, and it'll always be my greatest battle.
I wouldn't say that polycystic ovary syndrome is a fatal disease, but I would say that it promotes the development of high blood pressure, diabetes, and high cholesterol, and those are the three big risk factors for heart disease. So in a way, it's like a bullet that's fired, but it doesn't hit you for 30 years.
But as long as Ashley stays on the medication, exercises, and eats healthy, that bullet may never hit.
Ashley is doing very well now. She's much healthier than when she first came to see me 3 years ago.
The symptoms of PCOS vary from person to person, which makes it tricky to diagnose. Without Ashley's determination, she might never have found an answer.
I absolutely say to every single person, if you think that there is something wrong with you, no matter how crazy you think you are and other people think you are, you're most likely right on track, and keep pushing until you get the answers that you need.
Ashley had bizarre symptoms that came with the onset of puberty. But Len Geiger's terrifying decline began after almost a lifetime of perfect health.
I got into high school, I was on the swim team, on the soccer team, and did some gymnastics.
Len was always active, quite active. He's the one I always thought would break a limb and didn't.
When he was 33, Len was on a ski trip with a friend, and one night, something odd happened.
We decided to take in a little bit of the ski slope at night and skied maybe a quarter mile down the slope in the dark. And we, of course, had to walk back up in our boots in the cold. It was very strange. I couldn't catch my breath. I didn't understand what was going on. The friend who was with me noticed, and he made some comments about, aren't you glad you quit smoking, and things like that.
Len decided it was just a freak occurrence and didn't go to the doctor. But over the next year, his breathing condition got worse.
I started developing bronchial infections, chest colds that wouldn't go away. They'd last for 2 weeks at a time, be gone for a week, and then would come back again. So I'd go to whatever urgent care center that was open, and every time I'd go in, I get the same thing. It's, you have a bronchial infection, here are some antibiotics, go home, get some rest, take a couple of days off work, you'll be fine.
The infections eventually went away, but Len's problems were only beginning.
I started noticing that I was avoiding things. I was avoiding stairs, for example. I remember very clearly realizing that not all parking lots are really flat, that a lot of them have an incline to them, because I'd get short of breath going up the incline.
We thought that it was allergies or something in the environment that had to do with what was happening to him. But I didn't give it great concern because things come and go with children's health. So we thought it would clear itself up.
But as the weeks passed, Len's lack of breath became even more intense and debilitating.
Within a few months, I started becoming short of breath on almost a daily basis. And that's when I really realized that there is something wrong. I didn't know what it was. I didn't know if I wanted to know what it was, but I knew there was something going on. I began to get scared.
In 1992, Len Geiger was on a ski trip when he first experienced trouble breathing. A year later, his shortness of breath is beginning to interfere with his life, and Len realizes it's time to visit a doctor.
He says, you're obviously in good shape. You take care of yourself, you eat right, you don't smoke. Statistics say, as long as you buckle your seatbelt, you're gonna be just fine. And I wanted to believe it, so I did, and I went on my merry way.
Len decided it was just a matter of getting back in shape, so he hit the gym.
I remember the first week. This was with my ex-wife. Both of us were exercising, and both of us were horribly short of breath because we were both, both out of shape. And about a week later, she was okay. And I'm still wheezing, and I'm short of breath, and it didn't get any better at all. It never got better. If I pushed myself too far, I'd become so short of breath that my whole body hurt. It wasn't just feeling short of breath, but my skin actually hurt. You almost want to pound your chest because that sensation hurts so much. But at that time, I was thinking, it's just, God, I don't know what I was thinking.
After 2 weeks of painful workouts, Len could no longer ignore the fact that something was wrong. He sought out a new physician, Dr. Michelle Huggins.
He and I just immediately formed a connection. He did express frustration to me because his symptoms were beginning to interfere with his ability to do the things that he enjoyed doing.
To her, it sounded like some type of asthmatic episode. She wasn't really sure, but she said, let's try this inhaler. Gave me a prescription. It sounded like a good idea to me. It was the first medicine I'd been given for my breathing.
But the inhaler didn't work, and his breathing continued to get worse. It became clear to his family just how severe his condition was.
I remember the time that I really realized something was wrong, and that was at Len's 35th birthday party. All the family was there. It was in a very noisy place, and we had presents, and I was seated at one end of the table, and I recall that he did not look as happy as one would expect one to be.
And we had a great dinner, and afterwards, we went outside and talked for a little bit, and I was going to walk my parents to their car, and I wasn't able to because I couldn't catch my breath.
He said, "I'll just wait here at the door." As I looked back, I could see that he was leaning on something, and I realized that he was trying to hide from us, that he was in some distress.
My ex-wife and stepdaughter walked my parents to the car while I leaned on a stranger's car trying to catch my breath.
When I looked at him and saw the expression in his eyes, I was afraid.
If you take a drinking straw, put it in your mouth, pinch your nose shut, breathe only through the straw, and try and climb up and down a flight of stairs. That's what it feels like. It freaked me out.
And it brought it home to us so hard, we realized how very real and how very, very troubling it was.
Everybody had seen this. There was no denying at this time. There's something going on. I don't think I've ever been so terrified in my life. I called back my new doctor, Dr. Huggins, told them that I wanted an appointment for that day. And the nurses asked, "What's the nature of the visit?" And I said, "I want to know why I can't breathe, and I want to know now."
When he walked into the office, he appeared somewhat frustrated due to the fact that his symptoms had worsened.
She took it seriously. She listened to what I said, and she responded.
I decided to go on to order a chest x-ray, primarily to make sure that there was nothing else there that we might be missing.
But then, Dr. Huggins decided to order one more test.
What she wanted to do was to rule out this rare genetic disease that she just knew that I didn't have. I don't really recall if she even told me what the name of the disease was.
Len didn't give the test a second thought, but 2 weeks later, he was surprised by a phone call.
I was standing in my kitchen, wearing a suit, and it was Dr. Huggins on the telephone. And she called to let me know that the results had come in from my test.
And then Len heard the words that would change his life forever.
It turned out that that rare genetic lung disease that she was ruling out was my actual diagnosis. And it was a complicated name.
It was very difficult for me to call him and let him know that he did indeed have Alpha-1 Antitrypsin Deficiency.
Alpha-1 Antitrypsin Deficiency, or genetic emphysema, is a potentially fatal disorder in which the body doesn't produce enough Alpha-1 antitrypsin protein. When the lungs do not have enough of this protein, enzymes destroy the lung tissue, making it difficult for the person to breathe. While fewer than 10,000 Americans have been diagnosed with the disease, doctors believe the occurrence is much higher. Left untreated, Len's lungs would eventually shut down, and he would die.
He was sad. We may even have exchanged a tear or two.
Being told that that you're not going to live a normal life, being told that you're not going to live a normal lifespan. I thought I was going to live forever. That was my plan.
Hoping to reverse Len's downward spiral, Dr. Huggins referred him to a pulmonologist, Dr. Robert Schreiner.
I remember walking into the exam room and seeing a physically fit, tan man about my age who had the appearance of someone who was perfectly healthy. And that was very different from the man that I was reading about in his chart. The man in the chart was very ill.
In an attempt to slow the progression of the disease, Dr. Schreiner put Len on a weekly dose of the protein he was missing. But everyone knew that the only way Len could avoid a slow death by suffocation would be a double lung transplant, and the odds of finding a match were slim.
There's no doubt that the clock was ticking in Len's case. There have been times where patients passed away while waiting for their lung transplant to arrive.
I didn't have my health. I had lost my family. I'd gone through a divorce. Everything that I had defined myself by, what I thought people defined me by, I didn't have anymore.
After being diagnosed with a fatal lung disease, the only thing that can save Len Geiger's life is a double lung transplant. He is on a transplant list, but every day he waits brings him closer to death's door.
Len didn't have much time left. He was close to this disease taking his life.
I became depressed to the point where I was on antidepressants for a while, and we were honestly fearing for my life at that time.
He couldn't turn over with oxygen in the bed without being short of breath. He couldn't talk and breathe at the same time, hardly. We knew that time was running out.
Then in 2001, with the clock ticking down, Len received a phone call he will never forget.
The woman on the other line explained that she was a transplant nurse from the University of Virginia, and that they thought that they had a pair of lungs for me and wanted to make sure that I was well enough to do this. And I said, "Can you give me a moment?" And she said, "Yeah, take a minute." And I thought and said, "You know, these last 6 months have hardly been worth living. Yeah, I'm ready." I called my parents, said, "Pack a bag, it's time, let's go."
Racing to the hospital, Len knew that this transplant was his last chance for survival.
The next thing I knew, I was in an operating room, and the anesthesiologist looked down at me and he said, "Are you ready?" And I said, "Let's do it." And everything went black.
A double lung transplant is extremely risky. There's a chance that the body might reject the donor lungs, causing death. But for Len, there was no other choice. All his family could do was hope and pray he would make it.
When I woke up, I was very, very happy because waking up alive was my #1 priority. I was on a ventilator. There was a machine breathing for me, tubes down my throat. I couldn't talk because they went past my vocal cords, so you can't speak.
He was in intensive care at that point, and hooked up to so many things you wouldn't believe.
But he was there, and he was alive, and his color looked good.
And he was smiling.
The transplant was a success.
Within about 4 days or so, I was breathing completely on my own. Within 2 months of my transplant, this was the middle of summer 2002, I had taken up mountain biking. This was just amazing for me. I couldn't walk before, and now I was racing on a mountain bike, pedaling my butt off. There were times when I wondered if I had actually died during the transplant, and this was heaven.
A big determinant of how well patients will do after lung transplantation is how closely matched the donor lung is to the recipient's own immune system. And thankfully, Len received donor lungs that were very closely matched to his own immune system.
About 1.5 years after my transplant, I was lucky enough to meet the family of my lung donor. And it turned out that she was a 14-and-a-half-year-old girl. I carry a photograph of her around with me and look at her, and keeps me, I think, well grounded.
After years of struggle, Len has finally gotten a second chance at life, and his future looks bright.
If he avoids unusual infections or avoids, more importantly, rejection, he could live a full, long, robust, healthy life till his 70s, 80s, or who knows.
I feel absolutely phenomenal right now. Everything in my life has turned around. I don't think I could be any happier. I don't think I'll ever be able to take the ability to breathe for granted. It's sweet air.